Greetings, everyone from the United States. First of all, I want to apologize for not being able to make it down to Senegal. I am currently at another conference. It is the Cancer Health Disparities Conference, and it was impossible for me to be in two places at the same time. And I was already committed to coming to this conference. Additionally, I want to apologize if there's any blurry image or if there are noises in the background. I'm literally recording this presentation from my hotel room. It doesn't have the best lighting. Apart from that, there are strange noises around the room, but I hope that you can hear me very clearly, even if you cannot see me very clearly. So it is such a great pleasure to be here and be part of this panel that is going to be talking about clinical trials. I have been charged to do a 10-minute presentation, so I will try my best to touch on the highlights, and we can continue the conversation at another time, and if we're not able to cover everything that needs to be covered today. So first of all, I would like to go ahead and share my presentation. So let's see. So as already introduced, I am Folakemi Odedina, and I have the pleasure of serving as the chair of the AORTIC Research Committee until the end of September, where I'm going to be passing the baton over to Professor Solomon Rotimi, and I will be chairing the AORTIC Research Committee Scientific Advisory Board. I also have the pleasure of serving as Enterprise Deputy Director for Community Outreach and Engagement at the Mayo Clinic Comprehensive Cancer Center. It is a great pleasure to be participating in this conference virtually. My primary objective today is to introduce the concept of decentralized clinical trials to be used as a way to address the challenges that we face for clinical trials in Africa. I'm only going to touch on 3 points. So the very first point is just take a look at clinical trials background, and I think majority of us already know that, so I'm really going to quickly go over that point. The second point is to describe what and how to be able to do clinical trials decentralization. And finally, what is the path forward based on what we know about clinical trials decentralization. So just a really quick introduction on the background for clinical trials. But one of the things that I wanted to point out, as you can see on my right-hand side, is just a map of the clinical trials that is currently ongoing globally on clinicaltrials.gov. And that is a constant reminder of where we are in Africa, just to know that there's not a lot that is going on currently in Africa relative to oncology clinical trials. This may already have been said by our previous presenter, but as most probably we all know, clinical trials is a research study where one or more human subjects are prospectively assigned to one or more interventions. This may be placebo or other control to be able to evaluate the effects of these interventions on biomedical or behavioral outcomes. The 3 things that I really wanted to point out, that when we are thinking about clinical trials is no longer the traditional way of just kind of looking at therapeutic trials. Clinical trials can take the form of 5 different types. It could be mechanistic, it could be exploratory, it could be feasibility study, interventional study, or even behavioral clinical trials. So there are different types of clinical trials that we have when we're looking at clinical trials. And also for oncology clinical trials, when we think about oncology clinical trials, it is really a research study that we have that really participants are assigned to one or more escalated interventions anywhere across the cancer continuum. And what does this mean? It means that clinical trials could occur as prevention and risk reduction trials, screening trials. It could be based on diagnosis, treatment, survivorship, or it could even occur during end-of-life care as well. So why do we have to focus on oncology clinical trials in Africa? I usually put this slide up when I do any presentation on clinical trials. You can see Africa is the second largest population in the world. And by 2050, 25% of the world population will live in Africa. Cancer is a running trade in Africa. What this means to us is if we are going to conquer cancer in Africa, it becomes very important that we do have clinical trials that are conducted in the populations of Africans, and so that we are assured that the interventions and the therapies are tailored to the populations of Africa. As I mentioned, this is the map of cancer clinical trial of cancer studies from clinicaltrials.gov. We have done some publications that really went in depth into the clinical trials that is ongoing in Africa. That publication was done in the JCO Global Oncology, and you can find that. I believe it was published in 2020. But from this map, you can see that we are really not at par on where we need to be relative to clinical trials in Africa. So I want to sort of focus on what I've been charged to do today, which is to talk about the centralization of clinical trials. What is the clinical trials decentralization? Why are we looking at decentralization of clinical trials? And how can clinical trial decentralization be done? I really love what the Clinical Trial Transformation Initiative has been doing. It really has focused on how do we transform trials by 2030, given very clear direction and path to be able to do this. And one of the things that this initiative have brought forward is that by 2030, there are certain criteria that clinical trials really need to meet. One of them is patient-centered and easily accessible. And so decentralization of clinical trials is really focused on this aspect of accessibility of clinical trials for people, regardless of where they are, regardless of whether they're in rural, urban, or village, or remotely connected, or cannot be reached. We have to take the trials to the community, or take the trials to the people that need the trials. Other things that's been noted through this initiative is that trials need to be fully integrated into the health processes, very significant. It has to be seamless so that it's part of our healthcare system. It has to be designed with a quality approach. It has to maximally leverage all available data, whether it's clinical data, epidemiological data, or any other data that we have. We need to be able to use data to drive the trials that we're doing. And finally, it needs to be focused on improving population health, including improving the population health of Africa. And so this is the charge for Clinical Trials Transformation Initiative by the year 2030. And I think this is one of the things that Africa should also be working on towards as well. When we talk about centralization of clinical trials, there are really two unique definitions that are out there. The Food and Drug Administration in the United States looks at the centralization of clinical trials as technology-based human clinical trials that utilize telemedicine and mobile or local healthcare providers to be able to gather data, and which differ from the traditional design approach. So the traditional design approach, as you can see when I discuss later on, is that approach in which we do in a hospital setting or in a clinical setting, and we are not looking at taking the trials to the people. According to the National Cancer Institute, it is a trial in which data capture, administration of medication, and possibly other procedures are done at the subject's location, e.g. at home, by telemedicine, mobile technology, local healthcare providers like family physicians, general practitioners, and so on. I really love the NCI definition because I think it's much more broader perspective of looking at clinical trials, but both can help guide us in understanding what decentralization of clinical trials is. So if you step back, I really love this framework that is done by McKinsey Company. If you look at decentralization of clinical trial, essentially what it means is that we are meeting the patients where they are. We are meeting the population where they are. So if you look from my right-hand side, you can see what a fully centralized clinical trials looks like. All the trial procedures are conducted at large community-based centers, at the hospital setting, at the research center. That is where everything is. What does that mean? It means the patients need to come down to those centers for the trials to be done. If you start moving from my right-hand side all the way to the left-hand side, you will see as we have fully centralized to hybrid trials to fully decentralized trials. So some of the hybrid trials, you can have complex procedures are conducted and minor ones at maybe local clinics. So for example, you can collaborate with community clinics to be able to do follow-up or blood draw, and people don't have to travel to the large centers for them to get things done. Some low-risk trial visits can also be done through telehealth or alternative sites like local or mobile clinics or local community pharmacy settings, up to the trial procedures not requiring in-person care and are conducted via telehealth, remote data collection, or direct-to-patient supplies. And then you have fully decentralized, where all trial procedures are conducted either virtually, enabled by telehealth, digital technologies, and supply delivery as well. So as you can see, it is truly what it means. You can have the the trials fully centralized, or you can have hybrid trials, or you can have it fully decentralized. And the reason that we are actually thinking about this is meeting the patients where they are. Kind of think about your patients and how far they have to travel to come to the clinic. And think about if you're not asking them to participate in clinical trials and they have to do that all over again from wherever they are to come for clinical trials and come for follow-up and come to be tested at the large centers that you have or at the tertiary institutions that we have. That may not be possible. This is where the idea of decentralization of clinical trials is actually gaining some momentum globally. So what are the potential benefits of using decentralized clinical trials? There is the faster trial recruitment, because now recruitment is being done in different means that really makes it easy for you to get access to the patients. There is improved trial participant retention, because patients don't or participants don't necessarily have to come over to your center. You can find ways to be able to reach them. There's greater control, there's convenience, there's comfort for participants. So this is really patient-centric and participant-centric. And also, it allows you to have really significant diversity. So if you think about it, people who may be living in the village, or people who may be living in a rural area, or people who may be living in an area that you are not easily accessible for them to come to you. If you, for example, use a mobile unit to be able to go to them and reach them at a church or reach them at their local community pharmacy, then that means that there is increased participation by everyone, regardless of their background or regardless of their accessibility to be able to reach you. I haven't provided, as you can see, this is really a very quick description of clinical trials because I only have 10 minutes and I wanted to give time for the Q&A that is going to happen. So I haven't thought about what clinical trial decentralization is. What is the path forward for Africa? What can Africa be thinking about it? One of the things that I've outlined, and you can really, something that I've adapted from Kate Lipset's presentation, who is the founder for Clinical Innovation Partners, is to look at 4 different ways that Africa can actually think about the decentralization of clinical trials. One is the technology. You can do the e-consent, and the e-consent is having the electronic consent. So the person is not really where you are. You can use electronic consent, like using the use of email, like the use of Zoom, like the use of just for them to scan a barcode and be able to read the consent. Of course, you still need to have full disclosure of the consent or the informed consent process for them to be able to do it, but it is not going to be in person as you can. So you can use technology in that way. You can have e-diaries for them to be able to jot down any interventions or jot down anything that they need to write down. You can use video as a way to be able to educate, collect data, train people, get the consent, describe the consent to them. One of the studies that we are currently doing in Africa is the Iron Man study. With the Iron Man study, we actually created the informed consent by video. We're working with a group in Nigeria to do the informed consent by video, which makes it easier for them to be able to understand. You can do remote monitoring, and you can do digital measurements. So these are the use of technology to be able to support the centralization of trial. Some processes that you can think about is using the home health, where the person, the trials is going to be taking place at home. You can use local labs that are near where the person is living at. You can use local imaging. You can use drug supply to the home. You can actually collaborate with pharmacists to be able to do this, or actually use a pharmacy that is near the home of the person to do it. You can also facilitate the processes using central meta sites that are really highly accessible to the participants as well. Another way is to enable the visit by using hybrid and fully remote way to be able to connect. If you remember from what I presented earlier on, that image of fully centralized to fully decentralized, there are hybrid model that you can really use to be able to go from partial remote way of connecting to the participant to fully remote way of connecting to the participants. You can also create optionality and choices for the participants to pick, which will allow them to be able to pick a choice that is convenient for them in this hybrid way or in this continuum way of really being able to facilitate clinical trials for them. And finally, you can have a non-traditional ways of doing it. One of the things that we are literally innovating at Mayo Clinic, Florida right now is clinical trials at home. And it really is just a concept that is really a great concept. If we can do care at home, we should be able to do clinical trials at home. So non-traditional way is a way that you can consider maybe trials can be done at home, or maybe the pharmacy. The pharmacist is a great way. I have a background. My first degree is in pharmacy, so I'm always thinking about the use of that resources within the community, which are community pharmacists that are found in multiple places, and they're really highly accessible. There's so many clinical things that are not available to people, but one commonality of majority of places that we have in Africa is that you're always going to have a community pharmacy that is near them, or a medicine store that is near where people live. So that could be. You could also use community centers. You could use local health providers by partnering. One of the things that we are currently doing as part of our decentralization of clinical trials is we are partnering with community physicians for us to be able to have a way of doing trials with them. You can also have mobile pop-up sites, or you can have mobile units. One of the things that we run at Mayo Clinic is a mobile research unit that essentially the whole purpose of the mobile unit is to drive around to different communities where we have participants for us to be able to facilitate their clinical trials. So this is really, I just kind of wanted to spend my 10 minutes to give the highlights about what decentralization of clinical trials is, and also to think about how in Africa we can really, really leverage decentralization of clinical trials to be able to do some of the work that we do in the community. This is a starter conversation. I really don't have a lot of time in 10 minutes to be able to talk about it, but I wanted to also let you know that we can continue the conversation on Cancer Research Africa. Cancer Research Africa, which is really a communication platform. It's not an organization. It's a communication platform to foster research for African cancer scientists. We have been approached to do a series on how to use decentralization of clinical trials to overcome the challenges of clinical trials in Africa. So as we bring in this series, this is something that would be able to most probably give us some additional skills and additional tools in the decentralization of clinical trials. If you are interested in finding out more, this is the QR code for Cancer Research Africa, and then you can go to their podcast and you can follow them to see when the clinical trials sections is going to be coming out, which is just going to be some hot topics on clinical trial sections. Thank you so much again. I want to acknowledge all the grants that have supported our work in clinical trials. I want to acknowledge my team at Mayo Clinic, and also acknowledge the global team that we have through the Prostate Cancer Transatlantic Consortium. Thanks for the invitation, and I do look forward to participating in the Q&A panel section if I'm able to make it, if I'm able to be back at that time, as I will be traveling, but I'm hopeful that I will be able to connect at that time. Thank you.